Between 2005 and 2010, Cambodia experienced an orphanage crisis in which thousands of children were separated from their families and placed in charity orphanages to be used as commodities to attract donations. CCT is on a mission to address the root cause of the orphanage crisis. The root cause of development disasters like the orphanage crisis is the colonial nature of the international charity sector. Charities have colonised Cambodia's social protection system by privatising essential social services that run in parallel to the local public system. And what happens when charities are in control of a country's social protection? They invest downstream. Downstream development is best understood as the life raft at the bottom of a waterfall. Instead of stopping people falling in the river, they wait till they're already drowning. This crisis-driven system is an expensive model, both in terms of dollars and cost to society. After decades of this privatised downstream response, what has been achieved? Some individual lives have been saved, but a widespread culture of dependency and an endless conveyor belt of crisis and need has been created, keeping charities in business for generations to come. The solution is upstream. By integrating charity work into the public sector, we can build a robust public social protection system that shifts the power and control back to local communities. This prevention-focused system is cost-effective, both in terms of dollars and benefits to society, as it prevents people from falling into crises in the first place. Upstream development is the antithesis of the downstream model. It is best understood as a safety net at the top of the waterfall. It addresses the root causes of complex problems by giving local communities sovereignty over their own development so that they're no longer dependent on charity. A way to distinguish between upstream and downstream charities is if they're actively working themselves out of a job. An exit strategy is a clear proclamation that a charity is working upstream to solve the root causes of a problem. CCT's exit strategy is our Village Hive project. We have partnered with all 10 communes and 62 villages in Battambang district to build a public social protection system that will be delivered sustainably by the local community. Over the next 8 years, we will be integrating all the prevention and early intervention programs we were previously running privately into public facilities and handing over the reins for the local community to run independently. The Village Hive is an upstream model. It focuses on universal prevention by strengthening public education and public health. It focuses on early intervention by integrating an empowerment journey into public social services. These programs work together to safeguard the community against avoidable crises. Universal prevention services are available to all members of the community. They optimise well-being and create safe and healthy environments for all people. Village Hive Universal Prevention Services focus on public education and public health. The Village Hive strengthens public education in primary schools, high schools and teacher training colleges by improving infrastructure, classroom environments, the curriculum and syllabus, as well as resourcing and supporting local teachers and public school faculties. The Village Hive strengthens public health in village health clinics by improving infrastructure, clinic equipment and supplies, resourcing and supporting nurses and clinic staff, and improving clinic services. Early intervention services are targeted to support children, youth and families where vulnerabilities or special needs have been identified. Early identification of the need for additional support de-escalates risks and prevents crises. The Village Hive Early Intervention Program is a journey of empowerment that sees families strengthen their social and economic resilience to escape poverty and provide adequately for their children. The early intervention journey empowers families through 7 key steps. First, it offers families support to cover any gaps in their basic needs, like nutrition, housing, healthcare, daycare and education. Then, families record 1 month of their income and expenses. The data is then used to conduct a financial audit with families and set a financial goal. The caregivers then undertake financial literacy training and develop an income generation initiative to cover the costs of their basic needs themselves. When they reach their financial goal and can add to their savings each month, they become financially independent and don't need assistance anymore. In the future, if they encounter setbacks, they can borrow from their own savings, which makes them financially resilient. The Universal Prevention and Early Intervention Safeguards work together to reduce stresses within families, which in turn reduces the demand for crisis services. Village Hive Crisis and Recovery Services are specialised intensive services targeted at children, youth and families in crisis who are experiencing or have experienced harm. Village Hive Crisis Services include child protection, emergency hotline, counselling, crisis accommodation, foster care, care leaver support groups, family reintegration and disaster relief. In Village Hive communities, the data is already showing an improved standard of living, as well as a significant decrease in domestic violence and child-family separation. Ultimately, the Village Hive is a systems change initiative that proves upstream development is the only true pathway to ending poverty and breaking the cycle of charity.